We continue on Smile this morning. Strep throat is a common infection among children and adults. What are the signs and symptoms? Well, Dr. Guyan Chana, otolaryngologist and neurologist. Doc, why are you doing this to me? He zooms in now to discuss the causes and treatments for it. You could have just said Dr. Chana and done it away. You're giving me those words.
I'm fine with that, Neville. And ENT is fine. That's
yeah,
fine.
I hope I got the words right, though. Did I?
Yes, you did. You did.
Good to see you, my friend. How are you?
I'm good. I'm great. I'm great.
Yeah. No, I've already said it's just a common infection, but is that it? Is that simple? Do you want to explain a little more?
Well, it is pretty common, especially in the age groups that you outlined, 5 to 15 years. That's the age category that typically has this kind of condition. And even though we tend to use it, generally to describe any sore throat, it's not just any sore throat. When somebody has sore throat in this ear, well, you have to think about certain viruses which account for, up to 70% of all sore throats. But then you have the 20 to 30% of all sore throats that are caused by bacteria. And the most common bacteria would be what we call group A beta hemolytic strep. And that is the bacteria that can cause a lot of problems in children and adults. So your patient would present with your sore throat, and if the bacteria spreads to various areas, you can have difficulty swallowing, and if it spreads to areas of your voice box, then you can have hoarseness or even difficulty breathing. It can be a pretty dangerous condition to have in some patients who are at high risk for having complications. So what we look for, or what you typically would see with the bacterial strep throat, would be the redness and yellow discharge on the tonsils, and that's classic for bacterial tonsillar infection. Now that's important because oftentimes a patient would have a viral sore throat, and for those persons, antibiotics are not necessarily indicated. But if you do indeed have one with a bacterial strep throat, then you want to ensure that that patient is covered because of the possible complications.
Yeah. Does it present like anything else? Maybe I'm coughing and think it's the flu or something like that. Does it present like anything else, or I'm going to know that this is a little different than what happens normally?
Well, the typical Jamaican presentation is just that you have a bad sore throat, and unfortunately we use sore throat to describe many things, or we use flu to describe many things. But the differences would be the pain that's associated with it. It's usually quite painful and associated with quite a bit of fever. And if you look in your throat yourself, if you can identify your tonsils yourself, then you'll see some of those things that you see on the screen there, the white spots, the swollen tonsils, etc. You can have rashes on the skin, especially in children. And those are clear-cut signs that you have a bacterial infection going on. Now, why we have to address this, because of the risk of complications. You can have abscesses being formed that actually closes off the back of your throat and make it quite difficult for you to breathe. You can have abscesses, and as I mentioned, a child may present with not able to swallow, so they're drooling, walking around with their mouth just being open and not being able to swallow. And the key clincher, or one of the dangerous things you want to look for, is a child who has difficulty breathing, drooling, swallowing, voice has changed. You have to ask yourself, is this infection going down to the voice box and eventually making its way to the airways? Because that's when you can lose a child.
Yeah, you mentioned tonsils. I took mine out as a much younger person when I lived in another community, and I was told it acts like a filter, your tonsils. And someone told me I had to be careful because now that I don't have the tonsils. But I've been fine, thank God, since then. And so how does the tonsils connect, or how does the strep throat connect to the tonsils, and what are the dangers there re the tonsils?
Well, there's several problems that can arise from having tonsillar infection, and the tonsils tend to be the gatekeepers of your airway and the back of your throat. So any bacteria that enters will hit the tonsils, and the tonsils will therefore alert the rest of the body and say, okay, get prepared, something is coming on board. But usually as you get older and the rest of the body is aware of which bacteria is bad, which bacteria is good, then really you don't need the tonsils as much, and that's when it can just be a nuisance just hanging around there. Because on average, when we remove the tonsils, as you have done, the patients typically don't suffer from any significant problems or any immune compromise or anything like that. So we're not worried about that. What we're worried about is the tonsils getting swollen to the point of closing off your airway and your feeding passage.
Yeah. I'm not certain you told me what would cause strep throat, did you?
Well, there's several things. There's several risk factors. I mean, if you're in a communal setting, certainly a child who goes to school and they share everything from toys to sweets, you're going to have a lot of that going on. In the present COVID environment, we all are aware of what are some of the risk factors to spreading anything from the airways, coughing, sneezing, not covering your mouth, things like these. But if you have someone who's immunocompromised, have an immune issue for some reason or another, or they are taking steroids, or in some parts of the world they recognize that you can be vaccinated against some of the common causes of sore throat, then those are persons who would be less at risk for developing sore throat. So those are some of the generalized risk factors. And of course, getting ventilation in a well-ventilated area. So all of these COVID factors and all of these COVID precautions that we already know, washing your hands, sanitizing, those are ways to reduce the risk.
Yeah. Dr. Guyan, a double-barrel question. How prevalent is it and how contagious is it, if it is contagious at all?
It is quite contagious. And so when someone has this condition, we try to keep them away from, if they're in a school setting, we try to keep them away. If they're in a work setting, we try to keep them away. But I must emphasize what are some of the long-term complications, why it's not just a regular sore throat. Because you can have long-term complications where the bacteria now goes to the kidneys particularly and damages the kidneys, infects the kidneys, and you start peeing blood. And that's something that we're fearful of, because you can have long-standing kidney disease or even kidney failure. The bacteria as well can go to the heart and can damage the heart. You've heard of persons talking about rheumatic fever, rheumatic heart disease with long-term complications, including heart disease, heart failures. All of these things are real factors. So if someone has suspected strep throat, you don't want to miss that opportunity to get rid of the bacteria before it spreads to other parts of the body and it causes other complications that will be life-threatening and will be irreversible in some cases.
Okay, I asked earlier, how does it present itself? Do I cough? Do I just feel a little scratching and I know something not right? What happens to me if I have strep throat?
Good question, Neville. Now, the presentation can vary based on individual. But sore throat would be the commonest presentation. And it depends on the age group as well. A child may not come to you and say, look, I'm having a sore throat if they're young. They may just come and say, you may realize that the child is not drinking as much, they're not eating as much. You may recognize a change in the voice pattern. They may have a fever and you can't detect where that fever is coming from. They may just be malaise, lack of energy, just listless, and you may have to search for that. In a typical adult who would voice these symptoms, then they will tell you, oh, I'm having a sore throat, and you can look clearly and see it. Or you can do an endoscopy, putting a camera down and see if you can identify it. But the presentation may vary, but sore throat and fever would be the two commonest presentations.
Yep. Were I to get it, God forbid, and I don't know I have it, and I'm treating it because I don't know what it is. So I'm at home and I feel a little thing and I don't know. What could I do? I know I should see the doctor, but if I think I understand what is going on with me, are there any home remedies? Are there things that I could use that would I don't want to say cure it, but at least ease the pain and maybe stop the problem, or no?
Well, certainly if you have painkillers, and painkillers would help, especially with the fever and the pain, but we also advocate oftentimes to dissolve the painkillers in something, whether it's salt water. And you've heard this traditionally from the older folks. You gargle with warm salt water, and that actually helps. It helps to reduce the inflammation, and if you dissolve the painkillers in the warm salt water and gargle with that, then that helps even more. So there's still things that you can use that will help to reduce the effect it has on you. Certainly keeping yourself hydrated will help to reduce any of the side effects of the dehydration, etc. And those are the things that you can do as a home remedy. Keeping yourself generally healthy so you can resist infections would be helpful as well. There are natural remedies as well, and in the COVID period, we recognize that some of them have been used with significant effect. Your honey, your garlic, we all know these things. Yep. And if there's anti-inflammatory, the turmeric, which I'm sure you know, Neville, so yep. I don't have to tell you all of this.
Yep. Final question, Dr. Guyan. When do I see a doctor? As a parent, when am I supposed to be concerned and say, no, me have to go doctor now?
Well, certainly, if you have a child who has a fever that's spiking and is not being controlled, there are certain boards, particularly the American Academy of ENTs, they would suggest that if after 48 hours you have a fever that's not being checked, then certainly you may consider taking the child to the doctor to get antibiotics. But if you have a child who is dehydrated, because when children get dehydrated, they fall down in their health very, very quickly. Unlike adults, they don't have a lot of resistance to these things. So you don't want to wait until the last minute. A child is getting dehydrated, a child is not being nourished, you want to take that child to the doctor. The child is having fever, certainly spiking over 102, 101. Then you want to ensure you get that fever under control, because then you can run the risk of a child having seizures, febrile seizures as a result of that. And those are the times you want to include your doctor. Certainly, if you have concerns before, or if a child is one of those patients who would have recurrent tonsillitis, and you know beforehand that it's a high chance that it's a tonsillitis going on, or as a parent, you look in the child's throat, say, can you open your throat so I can have a look? And you may identify the tonsillitis, then certainly you want to take the child to the doctor as soon as possible to prevent the complications that we mentioned.
As always, Doc, very well explained. Great to see you, my friend. God bless you and the family. Look after yourself.
Good to see you, Neville.
Yeah, man. Dr. Guyan China, otolaryngologist, ENT surgeon, and neurologist. 10 minutes to your health. We'll do it again next Thursday.